Well, today, as you can probably tell, I'm in ecstasy again because I have two of my favorite people here to share with you and to share with me their wisdom and their experience from many, many years working with biological dentistry at a level that is so far beyond what most people call biological dentistry. And I just want you to know that, like myself, they never stop looking at what's possible, and how they can, in the most appropriate way, deeply respect your biology, your unique gifts that, are your body, and help you to have the highest quality of life that you can. And both of us have seen incredible damage happen in the past from the way dentistry has been done. Way, way back when I first came to Austin about 30 years ago, I was one of the people who had the honor of sitting on the DAMS group and working with a group of people who had really been damaged by mercury fillings and who had experiences of being normal, healthy, beautiful women. In this case, they were all women who ended up in wheelchairs shortly after they'd had mercury placed in their mouth. And who knows whatever other metals were part of those, bigger pictures. And after they went to visit Hal Huggins, they came back out of their wheelchairs. In fact, in some cases, right there in his office. So with this odd thing going on, and I know you have your own story that you can tell us too, Dr. Nunnally, about your own personal experience with mercury damage. I'd like you to let our listeners know about what we can do to only place things in our mouths that will respect our life force and our quality of life so that we can give more to our families, our communities, and truly give the gifts that we're here to give. I just want to say that my understanding of biological dentistry, and it's always been my experience at this amazing office that you two work at and share your love with and your wisdom, that I'm always seen as a person, not just my teeth, and how what you are doing is going to affect the quality of my whole life, not just the specific placement or the thing that you're doing with my mouth. So it's from that place that I invite you to speak today. And I invite our listeners to listen in deeply to see the depth of the care that goes into the awareness and understanding of what's happening here at Dr. Nunnally's office. Tell us the whole name of the office. I always just call it Dr. Nunnally's office. But now you have all these fabulous doctors. Nunnally, Freeman, Owen.
Yes, it's Nunnally, Freeman, and Owens is officially the name on the sign, but okay. We've had a wonderful, before long we're going to sound like a bunch of attorneys. So we've decided to limit it to Nunnally, Freeman, and Owens, although a wonderful dentist joined us 6 years ago, Rich Dorsey. And we have plans for others, but there's only so much room on the sign, and we don't want to exactly look either like a funeral home or a bunch of or a large law firm. Anyway, thank you for the sweet introduction. I'll lead off with what you were about to say in terms of mercury toxicity and what my own experience was. It's a great segue into Elaine Freeman joining me 20 years ago. Many years ago, 20 years ago, I got sick. In fact, about this time, 20 years ago, I began to have the first symptoms of what we thought was ALS. And I learned so much through that. It didn't turn out to be ALS. It turned out to be a mercury toxicity issue, but I was referred by the neurologist to the ALS Center in Houston. Interestingly enough, before that, I went to see a couple of other physicians because, as you know, when you're desperate, you'll look for help. And gosh, one of the wonderful ones that I saw along the way was Rich Massey. I'm so grateful for that time I spent with Rich. He was so encouraging. And But at any rate, I went to Montreal to see the old godfather of holistic dentistry, Hal Huggins, who encouraged me to have all of my dentistry redone, because over the years I had had my mercury fillings replaced, but I had had those replaced with materials that were not biocompatible for me. I really knew nothing about biocompatibility testing, and even at that time, 20 years ago, there was a laboratory testing dental materials to see if they were compatible with your immune system. Well, I had no idea that that was available, and Dr. Huggins tested me as it was. Everything in my mouth was highly reactive for me. And so in Montreal, he oversaw a dentist who replaced all of my old bonded fillings where I had had mercury fillings when I was growing up. And he did other things. For example, I think we've already mentioned with you once before, that he oversaw the dentist cleaning out my what are called cavitations, where I'd had wisdom teeth removed. So all of that was very, very significant in terms of my improvement. I began to improve after that whole experience, and I'm so thankful. There's so much that he taught me in that time. One was how to give someone hope when hope looks so bleak. And how to listen to a patient, how to really sit and listen. I remember my wife and I sitting in front of him and him listening for an hour and a half to our story. And just with his, it takes a lot of patience to listen to someone, all day long, to the patients that he saw with such difficult stories. And so anyway, I'm so grateful for that time that I spent with him. And then my issue did turn out to be a mercury toxicity issue. And so it's interesting, literally, Meridian, on the way, as Rebecca and I, my wife and I, were leaving to go to Montreal, Lane Freeman, who's sitting here next to me, walked in, and she had grown up in this practice, and she was a brand new baby dentist. And she came in and literally ran this practice. I didn't set foot back in it for 6 weeks. Well, I'm so grateful. It's like having my daughter just jump in and take over for me. And of course, then we've now worked together for 20 years, and we've learned so much of what we've learned together. Hal Huggins was a big jump start for both of us, of course, but we've been able to continue to refine and redefine in some ways what he taught us. And so I think I'll let you take it and tell Meridian. She already knows, but I'd like for her audience to know how we choose materials.
Okay. So we've already mentioned at the beginning that we have the ability to do biocompatibility testing. That's really the best way for us to decide on what materials are appropriate for each individual patient. And a biocompatibility test can be done with just a simple blood draw. We usually can do it in our office, but many times we'll have patients that we can send a kit to, and they can have it, the blood draw done locally. And then it is sent into a lab. And after, usually, sometimes we can rush the test and get it within just a day or two, but normally in about a week, we have the results of that testing, where they take the blood sample and they test the serum against thousands of dental materials. So not just fillings, but the bonding agent that would be under the filling, any crown materials, cements for those crowns, temporary materials for dentures and partials, and even implants. So it really gives us a good look at what is the most suitable material for each patient individually. So when we get that report on the front page, it's usually about an 80 to 90 page report that gets electronically sent to us, and we can print it out if we want, but we usually can just leave it in the patient's chart and forward that to them if they would like it for future reference. But once we get that list of materials, on the front page are a small grouping of materials that we use most commonly, because they're the ones that we have seen come back across the board as being the most compatible. There is one particular composite filling material company that we've seen really no one be reactive to. So we use that on a daily basis because not everybody chooses to have a biocompatibility test. So we take as our guide all of the biocompatibility tests that we've done, and those materials that we use on a daily basis are the ones that we found on probably 99% of the biocompatibility tests as being suitable. So that's the best way for us to choose materials. We do have some patients who take it a step further and may do some muscle testing to further narrow that field on what's specific for them. But that's what's important. Every once in a while, we'll have a patient who just pops up with an odd profile on their test, just meaning that we need to order something special just for them. They can't use what we would normally use, and that's the whole purpose of the biocompatibility test. Then we can order what's specifically appropriate for them, and that is where it really is important to have that.
We don't think about, we wouldn't think about, I think as lay people, we wouldn't think that we might actually in dentistry place something other than mercury, of course. I think just about everyone knows that mercury would be a toxic issue, but there are many other things in dentistry that have had a poor track record in terms of toxicity and never should have been used, unfortunately still being used. And so, for example, we never see anything that has mercury in it test as compatible. We've never seen anyone's immune system agree with that material or with nickel. I've not yet honestly seen one single patient who didn't test reactive to nickel. We know that in this country that over 50% of women in this country are sensitized to nickel and will react to it. If they put a nickel based earring in their pierced ears, they'll have a rash. And so it is. Many crowns in this country are still made with nickel underneath the porcelain. And so you'll see on the gum tissue the exact same reaction that you would see in their earlobe if they put a cheap earring in there. And we never see anyone who's non-reactive to aluminum. And many of the dental products over the years have aluminum in them. So I like the idea of using this biocompatibility testing. I also love to work with practitioners like you who can test someone energetically. And to tell you the truth, it's a fabulous way to test. It's unfortunate that in this country, from a liability standpoint, the compatibility testing, the serum testing, will have more favor in terms of a jury and a judge. But I think you and I both know that energetic testing can even be more specific than the cellular testing that we do with serum.
I think when we take a look at, that there's levels that we can all see and we can easily quantify, right? But there's some things that have to do with qualities and quantifying a quality, an energetic effect, the subtle things, how it's going to affect the emotions and the mind and things like that. We can't necessarily read like we could on a blood test. Right. And the issues also, with blood tests are all you're going to see in the blood test is what's in the blood. But you're not going to necessarily see what's in the bone marrow without doing some kind of a biopsy, right?
Sure.
So, it's a much bigger picture. And sometimes these energetic tests can be set up in such a way that they can read those more subtle things and help us to see where somebody may be suffering from a severe emotional issue that may not have a foundation in a biochemical issue. Yes.
And we know, in the eastern part of the world, this is widely accepted. And of course it is, even in Europe. I mean, many of our cohorts in Europe use energetic testing, electroacupuncture, according to Bowl and others, so that they test these materials, which makes great sense to me. You don't have to have a blood draw. The patient doesn't have to go to the expense, just the expense of having one of these tests done is in excess of $400. Right. So there are drawbacks, but it's at least an objective test that the courts and most of medicine recognizes as legitimate.
Yeah. Well, I'm glad that we have a way to legitimize it.
Yeah.
And, over the years, I've done so much muscle testing, and I also have energetic equipment from Germany. So, I use that also for people where we can see real subtleties of picking up sometimes bacterial infections and things that we wouldn't be able to pick up because of the great expense you would go through in a lab to look at over 1,000 different bacterial and fungal infections that you might find. So that kind of brings us to the whole realm of cavitations and what you're finding and how you find what's in those cavitations, and tell us what causes cavitations.
Do that, then you can talk about the analysis. So when we're talking about a cavitation, it is basically a cavity in the bone. It usually results from almost always an unhealed extraction site. So when a tooth is taken out, what we need to do is not only clean out any infection that is there, but also any of the periodontal ligament that surrounds the tooth. So periodontal ligament is soft tissue that completely surrounds the roots of the teeth, and it's what attaches the tooth to the bone. And so when you extract a tooth, it will kind of shred. So part of it would come with the tooth and part of it would be left in the socket. And then of course, if there was any infection in that tooth, that would still be there as well. So you have to actively clean out that extraction site. And if you don't do that, what can occur is that the site doesn't heal properly. Everything heals up nicely on the outside. An outer layer of bone may heal over, and the gum tissue may heal perfectly and look nice and pink and healthy. But on the inside, there is in fact that tissue. As the body tries to heal that area, it begins to try to lay down new bone and new tissue that doesn't occur properly. So you end up with a lot of dead tissue and dead bone in that area, which then causes the blood flow to become really sluggish. We need blood flow. That's what the body uses, obviously, to get infection flushed out of an area. And so when you compromise that, you have this nice little setup of dead tissue and not enough blood flow there hiding within the bone. So that bacteria sits there and releases its toxins. The body can't really effectively fight it. So it becomes just a chronic infection there inside the bone. So if we want to treat that, we'll have to identify it with a cone beam x-ray, a 3-dimensional x-ray, so that we can see within the bone, not just a little 2-dimensional snapshot. We need to see right where that is. And on a cone beam, this would show up as a less dense area. So it would be lucent or darker than the surrounding bone on the x-ray. And once we've identified that, then we can make a very small incision in the gum tissue over that area and gain access to that necrotic tissue, that dead tissue, and then clean that out and reestablish the blood flow in that area, and then place ozone and platelets to encourage that to heal properly. When we find a common population of bacteria in there, and I'll let Dr. Nunnally speak to that, but we can test that by taking, before we clean it, when we first get in there and access that site, we take a little sample of blood from that site, and we can send that sample in and then receive a DNA analysis of the types of bacteria and fungus and viruses that are in the site.
And is bad, and quite frankly, it's quite an array of bacteria. It's not uncommon to find 25 or 30 different species of bacteria in there. And they obviously, in this situation, even if they started out as aerobic bacteria, most of them are what we would call commensal aerobic bacteria that we find in the mouth. But when the tooth is removed and they go into an environment where there's no oxygen, they literally pleomorph into anaerobic bacteria, which is so clever. If we could only do that, we could sprout, gills and swim out of here like a fish when we dove in the water. But it's the most amazing thing. And now they can go from a fairly non-toxic bacteria to a very toxic bacteria in an anaerobic environment. And now we know very well what kinds of endotoxins they release. So the cell wall of a bacteria, when it breaks down, has a toxin associated with it. We call it an endotoxin. And these toxins are very, very well known to medicine. They break down into what's called an LPS, or lipopolysaccharide. And when you're measuring, for example, when you're measuring a leaky gut, And the bacterial toxins that leak through leaky gut, usually it's measured in terms of LPS. Well, these bacteria also leak out of cavitations. And this LPS and other toxins are very well known in the literature to cause dementia, depression, anxiety. You can just go down the list, and not to mention the physiological, but I'm just talking about the emotional impact of these toxins, like cognitive impacts. And so it's one of the reasons why I think so often when we clean these out, patients say, I can't believe the fog has been lifted. I can think again. And well, it makes perfect sense. These are potent bacteria.
I know when you did my mouth, we went over to the microscope, and what a wild array of stuff you pulled out of my cavitation. I love doing microscopic work. I've been playing with it for many years, even before I met Rich. And my teacher was way, way, way into talking about the terrain and how important the terrain is.
Yes.
And with that in mind, we also have the digestive system and how that seems to affect everything. And where does it start? But in the mouth.
That's right.
So one of the first things that I like to do when I sit down with a patient and we actually get to know each other a little bit is invite them to open their mouth and show me what they've got in there.
Mm-hmm.
And if I see a bunch of fillings, or I'll typically ask them if they have root canals. And they've complained to me about having chronic fatigue or some degree of brain fog, which is so common these days.
Mm-hmm.
I talk to them about the circuit breakers that our teeth are. And I know you have, and I have, these wonderful charts that talk about each tooth and how they're connected, not only to physical parts of the body, but emotional. So can you give us a little bit of a experience of all these years and what you've seen as far as relationships of teeth to different organs, to different health issues that people have come in with to talk to you about?
Well, it's interesting. We just gave a talk in Atlanta last week, and that was focused a little bit along those same issues and the impact that teeth have on the meridians. And we have a couple of patients who also happen to be staff members here, one of whom had crippling plantar fasciitis.
Oh boy.
And she's a lovely lady. I'm not going to say how old she is, but she's not near as old as I am. She walked like a 90-year-old.
Oh.
And it was just absolutely excruciating for her to walk. Well, she had 7 root canal treated teeth. And some of those teeth, it was in her, the bicuspids happened to be on the foot meridian. And so when we removed those teeth, and this is her testimony, overnight, and this is not, I would say, normal, but in her case, overnight, the plantar fasciitis was gone. We're talking about something that I wouldn't have believed, honestly, unless I'd seen it. But over the years, I remember so many times, Meridian, living in this small town, I'd be in our grocery store.
Yes.
Some old rancher would come up to me and say something like, well, Stuart, they would say, do you think that tooth you pulled last week could have had anything to do with my knee? And I would say, well, early on in my career, I would say, no, I don't think so. But now I would say, absolutely. And not only do I think it did, I think I would have expected it to, because it was on the knee meridian.
Yes.
And so now of course, patients now know that oftentimes teeth are responsible for an ailment in some distant part of the body.
It's so interesting. If it's the knee, it also probably had something to do with the kidneys. And so maybe he wasn't getting up so often in the middle of the night.
Well, true. We have a lot of men who come to us because of their prostate issues, and their physicians refer them here because the prostate is a magnet for heavy metals. Mercury loves to go to the prostate, as it does to the uterus in females.
Well, it's low down and it's heavy, right? By definition. So it's go to the lowest point.
Yeah, no, you're exactly right. It makes perfect sense. Now you explain that to modern allopathic physician and they'll just absolutely fall out of their chair. How could that be? But it's the truth. No, the heavier the metal, obviously it's going to go to the lowest point. It's maybe another reason why some patients, not only was this plantar fasciitis something that we've seen before, but I've many times over the years, I've had a patient say, do you know, I had this incredible pain in my big toe, like a gout, a gout pain, but not gout. This was not gout. This was a toxicity from a tooth, or the tooth being the circuit breaker that affected the toe. We fixed the tooth. Usually it was removing a diseased tooth, and the toe is over it. So it's fascinating and wonderful thing. And it's so much fun to see how magnificently we were created.
It really is. You know, one of my areas that I've just had an incredible fascination with is the newer understanding of the vagus nerve through Dr. Portis, Dr. Stephen Portis. And of course, we've got the vagus nerve coming right out from the mouth. And so I've heard stories about how a lot of referred pain goes to the upper jaw when the problem might actually be in the lower jaw. And dentists who don't know these kind of things end up doing 2 and 3 root canals on totally healthy teeth. How often have you seen that? And can you tell us what you do to make sure that doesn't happen in your office?
I've not only seen it, I'll have to say early on in my career, I did it. It's a difficult thing to determine sometimes. The vagus nerve is the 10th cranial nerve. The one that gets confused even more in dentistry is the trigeminal nerve, which is the 5th, and it sends branches above our eye, and then the 2nd division goes here and the 3rd division here. Very common for someone to have a toothache and the trigeminal nerve be stimulated. There's a particular intersection up here called the trigeminal ganglion, and for some reason, sometimes the pain will distribute to a totally different division from where the infection is. And so I would say it's one of the things that we work through almost on a daily basis. We're watching to see and being very careful, because I can't tell you, and I'm absolutely guilty of this. Many years ago, I remember doing a root canal for a patient and thinking for sure it was an upper molar. The patient got no relief. I sent them to an endodontist who did a root canal on the next tooth. He was convinced that it was neither. This patient had a diseased tooth on the lower, and the trigeminal nerve was interpreting it as a pain up here in this 2nd division. It's something we see quite often. One of the things that we see, even if it's not a tooth, is it can be truly a trigeminal neuralgia, where a patient develops a neuralgia associated with that nerve. And oftentimes the stimulus for it, or the place, or the infection is in a place completely different from where it's manifesting the pain.
You know, I have to come back to our original place. I mean, this is one of the beauties of these 2 amazing doctors, because they're looking at the person, not just the tooth, not just the symptom. Why are we having the symptom? What's beneath it? You know, and for me, a really big part of it, if we, get down to looking at things like pleomorphism, wish we could choose what we pleomorph into, right? But it really has to do with the levels of poisons and toxins that our body is trying to respond appropriately. And then we end up with all kinds of problems, from parasites to infections that are trying to eat up the chemicals and the poisons that are in the body, right? So what do you 2 do to encourage people to get to the source, to really get underneath and support those organs that I call the organs of drainage? And then so the drainage organs can support the detoxification, so that we don't continue to keep creating these problems over and over again. We have actually a new healthy mouth.
Well, I think one of the big things for our patients to realize, and that we daily talk about with our patients is that we are just one, your mouth is a very important layer, but we are just one layer of a patient's overall well-being. And so working with a health practitioner like yourself or many others many patients have done a lot of research on their own, but we kind of call it having a quarterback, a health practitioner that's really kind of leading the team, and we're a vital part of that team and taking care of what's going on in the mouth. But once again, each patient is so different. If we tried to just do a blanket detox program for every single patient, it wouldn't go well. Just like we're looking at their treatment of their mouth in an individual way, their detox has to be an individual process. And so I think when we recognize that with our patients, and we're just I have a sweet patient that posts a lot on Instagram about her health journey, and she's very clear about all of the different things that she has done and the people that she's worked with as far as that have helped coach her through her health. She's one of those lifelong learners, so she's always looking for what's the next level. And she knew that the mouth was a big part of that, but her nutrition, some things needed to change there. She had a particularly hard time detoxing at first. And so she worked with her health practitioner to work on a specific plan for her that then changed when her body started to respond appropriately. And so I think those things, recognizing that you can't just come in, and a lot of times we take a big load off the immune system by removing a toxic tooth or materials, but many times we're having to then help the body reverse that damage to fully heal as well.
And I think you're exactly right, Meridian. The last thing we want to do is put a patch on something. We want to get to the bottom of it, even if it's something just as simple as, I'm thinking of a patient I saw yesterday. Absolutely just a beautiful man, been a healthy man, but he came to me and he had I think he had 12 or 14 areas of decay. So it's a very simple thing to just go in there and patch those areas up and send him on his way. But instead, what we do is we take a little sample of the bacteria, just like you're talking about earlier, and we go look at it under a microscope. And that one thing alone is very motivational, because if we really want to get to the heart of it, it's what he's been putting on the end of his fork primarily that's caused the decay. Yes. And then the fact that he is not keeping his mouth clean. So we're just going to let's get to the bottom of this. We'll patch it, we'll get it cleaned up, and you'll have a beautiful looking smile. But if we don't coach you on what to do and what the real reason for this, you're going to be back here 2 years from now with the same problem.
Along those lines, and I hear you really clearly. You guys offer the most amazing initial consult where you actually go in and look at the health of the gums and the teeth and all of that. Will you tell us a little bit about that? And I mean, there's such a difference looking at a regular X-ray and a cone beam. I wish we could show them to people side by side, because I mean, when I've looked at the two, there's no way I can see a quarter of what's going on with the teeth with a regular X-ray. You look at a cone beam and it's like, oh my God, look at all the problems that are there with that tooth. And I would have never even had a clue. So could you talk to us about what you do to, that initial part of really exploring what's really needed for someone?
Yeah, okay. So we have a very comprehensive new patient exam that usually begins with the doctor, with us sitting with the patient and just talking for sometimes a long time about everything that maybe isn't in the mouth, just the rest of their health, because we need to have a good understanding of where the patient is from a health perspective in order for us to look at what's going on in their mouth appropriately. So that's the first thing, really listening to the patient and hearing their whole story, because that really plays a role in how they're going to respond to treatment and what we might end up recommending in certain areas. So that's the beginning of that. We also take we always like to minimize the amount of x-rays that we take, but it is necessary for us to have a certain number of x-rays, the most important of which when we're looking for infection is, as you mentioned, the cone beam x-ray. And just to hop back to what you all were talking about earlier with how do we try to not have that same problem of unfortunately incorrectly treating a tooth that isn't the problem, where it was actually another tooth. Probably in many of those cases, if a cone beam x-ray is used, you can catch that earlier on because you can see everything in such more detail. It's such greater detail with a 3D x-ray than you can with just a traditional two-dimensional x-ray. It used to be that's all we had. We had to just do our best with two-dimensional x-rays, but in the last 15 to 20 years, probably one of the greatest advances in dentistry, at least from a diagnostic standpoint, has been the ability for us to have on a daily basis access to that 3D x-ray. So if you look at a two-dimensional x-ray, you know, it's just a flat image. If we're looking at a three-dimensional x-ray, we can actually manipulate that image. I tell patients it's like they have a camera going through their face in multiple directions so that we can go all the way around a single root and look at it in every direction to see if there's any hidden infection around that tooth. It's also how we identify cavitations within the bone. We can also look at the sinuses. We can look at the jaw joint, all of those things that allow us to see exactly what's going on from a hard tissue standpoint, from the bone and the teeth. We do a real thorough exam of the mouth. Many times what's different with us versus maybe a conventional office is we're looking at the whole mouth. We might be looking at years and years and years of dentistry, not just one thing when we're evaluating a patient's mouth. So we do a thorough exam, looking at their teeth, their existing restorations, their tissue. We take a sample of under the gum line of the plaque and look at it under the microscope, as Dr. Nunnally mentioned, and that is a huge educational tool and motivational tool for a patient, because many times they feel like they're doing a great job. They feel like they're doing, oh no, I brush and floss twice a day and everything's great, nothing's hurting, nothing's bleeding. But then we look at that under the microscope and they realize that what they're doing while they're working hard is just not effective. So we have some things that we can offer for them to do at home in addition to what we can do in the office. So our goal is to, as we're doing that exam, not only to gather the information for ourselves, but then be able to show the patient exactly what's going on and then tie all that together with any treatment recommendations that we might have.
So along those lines, Dr. Freeman, what would you recommend that our patients can do on their own at home that might help to prevent them from having problems in the future?
Yeah, I would say one of the biggest things that we recommend just with overall health of the mouth would be using a waterpik with either a dilute solution of hydrogen peroxide or a dilute solution of apple cider vinegar. And so they can, on our website under our hygiene tab, there's a bunch of recipes for that. That's probably one of the single most effective home care things that patients use, that they see. If they use that tool at home, they can make a change in the slide before they even come back and have their teeth cleaned by our hygiene team and utilize ozone. They make a big difference just with that. Now, in some cases, there's too much buildup, if it's been too long, and if we need to get in there first and help the patient. But I think the waterpik, using those things, is one of the most effective tools that we have that somebody can use at home, in addition to diet and taking care of your mouth in that way as well.
Yes, that's great. Well, I think we've covered a lot of ground. Is there anything that you two would like to share that we haven't so far? What do you think we need to know about Dr. Nunnally?
Well, I think it's a good idea at this day and time for especially your clients to be looking for a biological dentist, because many times dentistry is just overlooked. There are not nearly as many of us as there should be and needs to be. I mean, of course, we're busy, and what we do is we tell people, if you're looking for a biological dentist, one way to search this out is to go to IAOMT.org, which stands for the International Academy of Oral Medicine and Toxicology. Worldwide, there are about 1,500 members in that organization, and most don't do, quite frankly, what we do, and there are others, and I don't mean that in a braggadocious way. I'm telling you, it's hard to just pull off all the aspects of what we think are critical in a holistic dental center, but still, patients could go to that website and they could find a dentist in their locale who would at least remove their mercury fillings in a safe way. In fact, that organization has established a protocol called the SMART protocol it's an acronym for Safe Mercury Amalgam Removal Technique. And if a patient selects a dentist who is SMART certified, then I think he or she can feel confident about having their mercury fillings removed in a safe way. So I just think as much attention is being paid by patients who come to you and other healthcare providers, they should not overlook the importance of dentistry. And I've seen over and over again, many times we're the last stop after patients have been all over the country, all over the world. We see patients who have been all over Europe, and finally someone, they land at Meridian, Grace's place, and she says, well, let me look inside your mouth. And so, and then we see them, and oftentimes they have a significant improvement in their systemic health.
You know, we like to look beyond what you can see with your eyes. And I have an amazing piece of equipment from Germany that's been used for like 35 years called regulation thermometry. And it's actually reading one of those things that we can't very easily quantify. It's the autonomic nervous system.
Mm.
And it's quite amazing. It looks at every single tooth. Now, that's only one part. It goes through the whole body. And it's started out being used primarily for breast cancer, but honestly, it reads the whole body. So it shows us for men prostate cancer possibilities. It's not diagnostic, but it gives us a pretty strong indication if we need to look deeper. But it also shows us what's contributing to the challenge of an organ or a tissue. And I have never found a woman with breast cancer so far who did not have a problem with one of her second molars. You know, it's come up every time. So our mouths seem to be telling us a lot more than just what's going on with our teeth. And there's that whole idea that, you know, everything affects everything. But this is so profoundly so. And, you know, a piece that, of course, Dr. Massey loves is to look at the emotions that are affected with each body part.
Yes.
And we have charts that not only show us, you know, the limb and the organ and the gland of a specific tooth, but also the likelihood of emotional challenges that could have contributed or even been the ultimate cause or even inherited cause of a predisposition to a problem with a specific tooth.
Yes.
You know? So it's a fascinating bigger picture, and through the mouth, which you two have, you know, made part of your great gift to humanity, you've helped people to see how they can bring true healing on multiplicities of levels to those who are seeking this type of very specialized support. And I just want you two to know how very grateful I am that you are doing what you're doing. And along the lines of what you shared about the SMART certification, tell me if I'm wrong, Dr. Nunnally, but it's my understanding that in order to get that certification, you just have to fill out a test form, but nobody comes and really sees what you're doing in your office.
Well, it's not quite that easy, but no one does. Yeah, no one does come to your office to inspect you. When that whole program was established, the hope was that patients would actually report a dentist who did not follow that protocol.
Right.
And then the IAOMT would bring some enforcement measures against the dentist who violated the protocol.
Mhm.
So as it turns out, in order for a dentist to become SMART certified, he or she does have to go through a good deal of continuing ed
Mhm.
and take quite an exhaustive test. And but then if they choose not to follow the protocol, that would be terribly disappointing to the organization, because the organization put so much time and effort in trying to make sure that these dentists were properly vetted. I'm hopeful that we don't have instances of that.
I understand. I am too.
Yeah.
I just know that there's very few people who have invested the type of money, time, education, ongoing, diving deep into the causes of true health and what might get in the way of it, as you have and the doctors in your office. And I just want to see what we can do to encourage more and more of that. And I think this is one important step about educating the public to know that this is available and that there are amazing levels of help that are available. And if we choose to only go to the dentists that are actually doing this type of support for us, perhaps our money will vote, our commitment will vote, and our encouragement to our dentists to really take care of our mouths and honor them. And as we begin to start learning how to start honoring our own bodies.
Well, and you're right. And that's what's happened is I was a part of this IAOMT for many, many years and saw very little growth.
Mhm.
But when dentists began to realize that the patients were demanding this and that they were sick and tired of traditional allopathic medicine and dentistry, then dentists began to get on the bandwagon, whether they had truly an interest in holistic medicine or not. They didn't want to, they wanted to be in a profession where they had a decent livelihood and income. And so it's okay, no matter what motivates people to get into holistic medicine or dentistry. I think they should make the move. And sometimes it's so important. I think patients resonate with holistic, most things that are integrative or holistic. Sometimes it takes a lot to change the mind of those of us who have really been brainwashed into believing one particular way. So thank you for allowing us this time to help educate your clients.
Oh, bless your heart. Thank you with all my heart.
Thank
May
you.
you be blessed beyond measure for your incredible gifts that you live in the world.
Thank you, Meridian.
You're so welcome.